So welcome back. The show is Breakfast Daily and is sponsored by Creamy Plus and Sky Water. And you can get in touch with us on WhatsApp using 024 That's our WhatsApp line. Now we're going to Sissala East, and in Sissala East there are infrastructure challenges that are impeding healthcare delivery. Let's take a look at this report by our colleague Latif Mahama.
The Sissala East Municipal Health Service has over the years been adjudged as the overall best performing district among the 11 districts in the Upper West region. According to the 2022 Holistic Health Review, the district is considered as a high performing zone, scoring more than 80% in the 92 health sector indicators. With 100% CHIPS functionality, the Sissala East municipality has 52 CHIPS zones, thus ensuring that patients do not travel far distances to access healthcare services. Health officials in the district, however, say the deplorable nature of some health facilities in the district, coupled with inadequate doctors and other critical health staff, is derailing the gains as most of them do not have storage facilities to preserve their medicines. The Sissala East District Director of Health Services, addressing various stakeholders at their annual Holistic Health Review meeting, says there is an urgent need to address the infrastructural gap to sustain the gains made in the district.
Over 60% of facilities are in very deplorable states, require rehabilitation works. A lot of our facilities have depreciated in their loops and need to be facelifted. Over 50% of CHIPS compounds operate without potable water. 6 CHIPS compounds are not connected to national grids, affecting service delivery. The areas of vaccine storage and 9 calls. A call to the municipal assembly. Close to 50%, specifically 23 out of 52 CHIPS zones, have no toilet facilities for both staff and then clients. Protracted shortage of ready-to-use therapeutic foods for the management of SEMA cases. Shortage of some vaccines for the period under review. No network connectivity in about 20 health facilities affecting service delivery, particularly in the area of generation of National Health Insurance Scheme, CCC, monthly report entries, and then referrals.
Citi News checks at some health facilities, including the district hospital, confirmed the situation. This is the children's ward at the district hospital. The facility has been abandoned due to life-threatening structural defects with leaking roofings. A nurse in charge of the Pediatric Unit complained that the situation is having a toll on healthcare delivery, as children are now compelled to receive treatment in a crowded ward where the unit is now relocated to.
Sometimes you'll be sitting down before you realize the bulbs start blasting themselves. Then one day we were sitting here, we could see water dripping down to the floor. As if that was not enough, we saw that the whole building was caving in, as you can see. During the period of, let me say, September, which is one of our peak season, we don't do cleaning in the water. They don't mop because the whole place is congested. You can't even walk. Sometimes when you're even talking to patients, you can't hear them. The whole place is very noisy. So, and I think one of it to our profession is that it contributes to medical negligence, because once you put patients together, they can have that kind of maybe exchange of drugs and what have you, and even cross infections. Because if I come here with malaria, but before I go home, I'll get skin infection, because we are all pairing the same. And even as it is now, the world is supposed to put all patients together, because we have certain conditions that we use to sectionalize them. Like this room, if a child happens to have something, an infectious disease like TB and what have you, that doesn't need to be combined with other patients. If you have chicken pox and what have you. But here's the case, you have not even gotten the space, you have to just put them together.
The Member of Parliament for Sissala East, Amidu Chinya Isagu, presented an ambulance to the Wolmbele Polyclinic as part of his efforts to improve healthcare delivery in the district.
Care will be one of the priority areas I'll be working around to see how I can make sure that the healthcare of my people is taken care of. And as you know, the Wolmbele Polyclinic is the second biggest health facility in the constituency. And also because the Sissala East is a vast area. I mean, from here to Tumu is a long distance. And from here, even towards Nabulobo, Wisubele, it's quite distant. And so for somebody to move from Nabulo or Gosi to Tumu, it's quite a distance. So this catchment area, the Wolmbele catchment area, certainly deserves a facility that can take care of the people within this catchment area. The Wolmbele Health Center has been upgraded to a polyclinic, and with the upgrading, it must come with certain facilities. An ambulance is one of them, so that anybody with healthcare issues around the Wolmbele catchment area, the ambulance can quickly go and pick the person and bring the person to the Wolmbele Polyclinic.
The annual Holistic Health Review meeting, which was under the theme Improving Health System Financing and Support, Critical to Effective Health Service Delivery, was a platform to review the performance of the past year and to plan for the ensuing year.
All right, so that's it there. The story brought to us by our correspondent Latif Mahama. Now we're going to be talking to Abdullah Adnan, who is the administrator of the Tumu Municipal Hospital. Mr. Adnan, good morning.
Good morning, sir.
Welcome to Breakfast Daily.
Thank you very much.
All right, so generally speaking, let's talk about healthcare in your area, just generally in the Sissala East area, before we look at your hospital specifically.
Okay.
What's the general condition in terms of infrastructure, in terms of consumables, in terms of just the basic things that you need to run health facilities in the Sissala East?
Good morning, and thank you so much for giving me the opportunity. Well, it's not been easy for us, particularly with regards to the funding. You know, mostly 98% of our clients here are insured.
Okay. As a national insurance?
National health insurance.
Yeah.
And so when the funding is not forthcoming, it's sometimes very difficult to provide healthcare services to clients, particularly with regard to consumables and all that.
Yeah.
But so as and when they pay, we always try as much as possible to buy the consumables, the basic ones that we need to run our services. So that is the situation that we have at hand.
Okay, and in Tumu, Tumu Municipal Hospital specifically, what's the situation? What's the situation like? I'm sure it's similar, but it's something that you have to deal with on a daily basis. So talk to us about your peculiar challenges on a daily basis.
Well, that's just what I just said. Yes, when it comes to issues of logistics, mostly it depends on the funding. And now most of the suppliers don't want to give you supplies because of the situation we have at hand.
Yeah.
They demand that you give cash.
Okay.
Before they will give you the logistics.
Yeah.
So that has been our challenge for now.
Okay.
These days, that has been the major challenge.
How do you manage to keep the facility going, considering the challenges that you have?
Yes. We have a procurement officer who is doing very well. And so most often he tries to contact the suppliers and to lobby with them so that they can give us the supplies. As and when we have funding, we reimburse them. So basically that is what we are doing to run in the facility.
Right. Now,
yes.
let's look at infrastructure. Let's look at the building there. What are the challenges there? Do you have the wards? So, for instance, do you have a pediatric session? Do you have the maternity? Do you have wards? How is the situation like?
Well, we have the wards, but most of them are very small. They are not as considering the amount of clients that we receive on daily basis, and they are very small. The number of beds in them are not to the level that we would want. Yes. For instance, if you look at the maternity units, for instance, we have about 30 beds there. Yes, but sometimes you get more clients than that, and some are compelled to lie on the floor sometimes.
Wow.
When you go to the general ward, which is male and female, it's equally the same thing. Yes. So most often, especially the rainy season, clients are compelled to lie on the floor, which is not the best.
Yeah.
So that is the situation
Right.
at hand. And
Now,
when you come to
go on.
okay,
Go on.
yes. And as I know you called me to because of the children's ward,
Yes.
and that is another issue we have. The children's ward that has been closed for about 3 years now. About 3 years now.
Did you say 10 years?
3 years.
3
3
years.
years.
Since
Okay.
2020,
Why?
yes.
Why?
Okay.
Yes. The roof caved in. The roof of the building caved in, and it caught fire too
Oh.
in 2020. So we had no option than to close it down. So since that time, we have made we closed it down since 2020.
Right. So what has been the conversation on that? What is going to be done about it?
Yeah, we have engaged all the stakeholders involved. We have engaged the Municipal Assembly in Sissala East. We have engaged the DC, the member of Parliament for Sissala East, the Tumu, and all the other stakeholders involved. So they are aware of the situation.
So how do you handle admissions of children now?
Well, now we have moved the children's ward to the current emergency ward, which is far smaller than the children's ward. And we have moved the emergency ward to just a corner, a cubicle around the OPD, which contains only 3 beds as the emergency. And the children's ward, where we have moved the children's ward, is only about 15 beds, which is far lesser than the original children's ward. So you can imagine the challenges that we face over there.
Now,
So when they are
on average, on a normal day, what
Yes.
are the OPD figures like? Generally. Yeah, not
Yes.
just for children, but generally.
Yes, okay. That one, I think that on a daily basis, we can get like from average 100.
Okay.
Yes, 100 clients on an average.
Now, let's also look at personnel. Do you have enough
Okay.
doctors? Do you have enough nurses to attend to patients?
Well, we are having only one doctor, but recently a new doctor has been posted to the facility about 2 months ago. So making it 2 doctors now in the hospital.
Okay.
And yeah, regarding the nursing situation, that one is not so bad. And the other cadets of staff.
So
Yes.
beyond, you earlier mentioned funding, money issues, the fact that a lot of the patients who come in are on the health insurance, and so
Yes.
generating funds become quite a challenge. Now,
Yes.
apart from that, what will be your top 3 challenges, that need urgent attention?
Well, that one is the children's ward is our top priority. Right now, it's something that is really worrying us. And so if we could get some support for it, it will help us a lot. Yes. Besides that, the infrastructure is also a challenge. As I told you earlier on,
Yeah.
considering the number of clients that we receive and the wards that we have, if some of them could be expanded for us, it will help us a lot.
Right.
And I must also add that if you look at the hospital,
Yeah.
we don't have a mortuary facility.
Oh, wow.
So when you go to the nearby, when you look at the nearby district, Sissala West, and then Y East, and then the DBI, none of these districts has a mortuary facility. And so when there's an issue of death, sometimes the person can be in the ward for some hours before, which is not good enough. So if you have such deaths, you have to transport them to Wa or to Nadoli, which is far away from the Sissala East district.
What's the driving distance from Wa to Tumu to Wa?
Is about 3 to 4 hours.
Wow.
Do you have an ambulance?
Yeah, we have an ambulance facility in the
Okay.
facility. We have that one.
All right. Now, you mentioned that after the children's ward had issues and had to be closed down, you had meetings and engagement with various stakeholders. What is the way forward?
Well, they have given us assurance that they would work on it. Even recently, about a month ago, we went to the assembly again, and they have given us assurances that this year it has been included in their budget.
Did they give you timelines?
No, they couldn't give us any timeline, but that is what they told us.
Well, thank you very much, Adnan, for your time.
Okay, thank you, sir. Okay, bye.
All right, so that was Abdullah Adnan, who is the administrator for the Tumu Municipal Hospital. And again, it just seems like some places, everywhere has challenges, but some places just seem to be forgotten more than others.
You know, I'm looking at being on the ward. Forget about even the doctor for now. Being on admission, somebody next to you dies, and you have to stay with the person for like
3 to 4 hours.
No, that is the travel time.
No, he said about 3 to 4 hours before they can move the body, because there's no place to take them to.
So you stay there with the dead body, and you're watching the dead body. You know, apart from the health implications, i.e., be there with a dead body, the psychological effect that it has on you, knowing that this is somebody who is dead. You know, I mean, and you are sick. You probably were speaking with this person last night, you know, and the following day he is dead.
Well,
and look at the whole, you know, on your healing process, because then it looks like, Charlie, am I next? You know. Look, we take some of these things for granted, but accessing healthcare delivery goes beyond just medicine and injections.
So
you know?
The question also comes, why is it that it's only in Wa that there's a mortuary? All the health facilities that are there, these are hospitals.
Yes, yes.
They're not clinics.
No, and I think that, you know, I mean, if there's even just one mortuary, you know, to serve the community. Because my worry is people are here for healthcare delivery. People want to heal from whatever they are suffering, and then someone dies and we have to stay with a person. We are now looking for, you know, a place where we can move the person and all that. The WA mortuary is also serving a certain...
It's constituents already.
You get it? So do they have enough space? What is going to happen if that place is full and all that? I mean, I think that this is something that we really need to pay particular attention to.
All right, we've been joined on the line by Amidu Chinia Isahako, who is the MP for Sissala East. Honorable, good morning.
Good morning, my brother.
Welcome to Breakfast Daily.
Thank you.
All right, so the situation we are talking about this morning leaves much to be desired as far as the Tumu Municipal Hospital is concerned, but just generally in Sissala East. What are some of the things that have come to your attention that you are making efforts to try and address?
Well, thank you very much. Let me say good morning to you and good morning to your viewers and listeners. The Tumu Municipal Hospital was built many years ago as a health center, and over the years it has been upgraded to a district hospital and subsequently to a municipal hospital when the district was upgraded to a municipality. But if you look at the structures in the municipal hospital, you see that all of them were constructed long ago when the health facility was put up. And I mean, modern days, we've not been able to add enough infrastructure to the existing ones, and we've not also been able to rehabilitate most of the structures. And I am very much aware of the situation, the deplorable nature of the facility, especially the children's ward. It has come to my attention, and as Member of Parliament, I have tried collaborating with the Assembly. I have also written to Ghana Gas with the budget and the whole for a renovation of the facility. I have also written to Common Fund But at the moment, I haven't gotten any positive response yet. I've done follow-ups, but I haven't received any positive response. So what I have decided to do with the assembly is to award it on the at our local level, so that construction or rehabilitation can start immediately, because it needs very urgent attention. So we are in that process of doing the bid documents and getting it awarded for it to be reconstructed.
Yeah.
I'm also aware that there are issues of light fluctuations because they don't have a separate transformer, and oftentimes they get lights off and all that because of the huge dependence of people on the transformer that the hospital is connected to. And so we are also working on that with VRA, and we are hoping that in the shortest possible time we'll get a dedicated transformer to the municipal hospital. So these are some of the challenges and many others, and we're working on them gradually.
Now, you made mention of the fact that the Tumu Municipal Hospital was built a long time ago as a health center. At the time that it was upgraded to a municipal hospital, are you aware if there were any extra structures added to the existing health center?
Not.
So it literally became.
It's the same. It's just the name that has, changed from a health
center
facility to a district health facility to a municipal. But in terms of infrastructure,
nothing was added.
Nothing has been added, and that is the biggest challenge that we face. As we it's something we have been looking at, especially when I became member of parliament, as a matter of concern. And I have advocated that these new hospitals that are being constructed, in fact, Tumu deserves one of them, but the assumption is that Tumu has a municipal hospital. But the fact remains that this is a facility that was constructed as a health center, with a much added upgraded to a district hospital, and with a much added upgraded to a municipal hospital. So it's just the name that has changed, but in terms of infrastructure, not much has changed. And the biggest problem, if you associated with it, is that even the old infrastructure that we have not been able to rehabilitate it, at least to not just the children ward, even the main ward, the maternity ward, all of them need some facelift. I know over the years the hospital, by its own internal arrangements, have been doing some little work on those facilities, but it actually needs major work. And apart from adding additional facilities, the existing ones need some rehabilitation of the sort.
Right now, Honorable, let me ask you about the mortuary. That is of very paramount concern to me, because if someone dies and they have to stay at the ward, for some hours before we can decide where we are even taking them, that is a very serious issue. Now, have you considered, in your talks with the Assembly, the District Directorate or Municipal Health Directorate, so for instance, go into maybe a PPP, bring a private person in, if they can put up a mortuary service, to augment whatever the hospital is doing, so they can take some of the burden off the hospital, especially now that we don't have clear timelines as to when we are getting some of these challenges fixed. Would you consider something like that?
Well, I will have to engage the Assembly, the Municipal Chief Executive and the Assembly to see, but at the moment we have not actually thought about that. As far as I can remember, the last discussion we had was there is a project that the Assembly was expected to submit some key projects for implementation, and one of the considerations was for a mortuary for the hospital. But the project hasn't taken off. But the Assembly has decided that if the project is going to be undertaken, one of the things they will want done is construction of a mortuary. But we'll review it and see how soon the project will come. And if it is not going to come soon, and we have to look at the options of a PPA, we'll look at it. But as a matter of fact, we need a mortuary because you cannot have a dead body. Once somebody passes, there should be a mortuary for the person to be moved from the ward to the mortuary. But for you to allow the dead body to be in the midst of those who are sick, certainly will give some psychological disturbances to those who are sick in the hospital, and that doesn't augur well for our development. So the need for a mortuary is critical, and like I've said, we'll review the project. If it is not something we are going to get immediately, we can also look at the option of the PPA.
Now, Honorable, you know, there are people watching us who I'm sure are in good standing, you know, to support. They could be indigenous, they could be other, maybe NGOs, people who are just concerned. Paint a picture to us, I mean, the clearest picture you can paint in terms of funding on some of these projects. Now, per your engagement with the assembly, per your engagement with, I don't know, about the ministry and all that, do you think that this is something that we could be looking at in the next maybe 1 year, in the next 2 years, that we can say that we can start something? Or it looks like, look, there's no money now. And so with all the plans, with all the ideas that we have, it will really take quite some time before we can even start anything meaningful. So people who are watching and would want to help can do so. What is the true state, you know, of finances in this regard?
Well, of course, if we had the finances, I don't think we should have been still discussing about these projects going to be undertaken in the near future. Like, I listened to the hospital administrator speak. My attention has been drawn to this. I mean, it's over a year now. The municipal, the Dr. Wu, has actually written to me formally, I think in latter part of 2021, which is about 2 years now. But we have not been able to undertake these projects because of lack of funding. You know, as Member of Parliament, the funding that I get as my share of the Assembly Common Fund, if I am to even renovate and look at the cost of the children's ward alone, if I am to do it, I mean, paying the contractor will be a problem because, I mean, the fund will not be there. And the Assembly too had some other commitments that they are trying to sort out. And then, but this is a matter, it's an urgent matter. I was thinking that my application to the various places I have mentioned, I would have yielded some result by now. But I think that once it is not yielding result, we need to look for them to immediately attend to, especially the children's ward. And so funding is a challenge. The mortuary, like I've said, we are not looking at funding from within the Assembly, but there is a project that is coming to the Assembly. I mean, it's a collaborative project, and the Assembly's option is to put the mortuary project on that particular project. But like I said, that funding too is not ready as of now, and so we have to review it and see and engage the partners. If it is not something that will happen immediately, then we have to start looking at other options. But like you rightly said, I mean, those who are listening to us, if there is anybody who wants to collaborate with the Assembly in undertaking any of these projects as a public-private agreement, the Assembly will be willing to engage such individuals, organizations, so that we can find some solutions to the urgent matters that confront the Tumu Municipal Hospital.
Right. Honorable Amidu Chana Isahako, MP Sissala East, thank you very much.
Thank you.
All right.
So this is it. I mean, long story short, there's no money.
There's no money.
Yep.
Yeah. Well, okay, so no, they say there's no money because every time we've said there's no money, something will come up and then suddenly money has been allotted to it. So there's no money for this for now.
Yeah.
Yeah, that's really what it is. Yeah, it's unfortunate, but we call on especially people who come from that area, you know, who have done well, who maybe live in Accra, live in Kumasi, live outside the country, who have done well financially, are doing well, to, put some monies together, go back home and help people from Sissala East, from Tumu, from Sissala East. And let's better the lot of Ghana as we spread this around the country. Everybody should look back where they come from and do something, to impact from where you came.
I mean, the way you're speaking, one song comes to mind, Ome, your mind, Ome,